I want to start by expressing our sincere sympathy and our heartbreak that we are feeling, as well as you in the community, for the violence that unfolded here today. I want to clarify that we have had 12 patients that we have treated, 11 of which are children with 9 gunshot wounds. None of those patients all of those patients we expect to have a full recovery, none of which are in critical condition. I want to also thank all of the teams that were on site today. Children's Mercy had specific staff down at the event so that we could proactively prepare for an event such as this. Our staff were able to put their training into good use today, and we are thankful for all of them remaining professional, calm, and coming to the situation with ease and grace.
Question? 9 children shot. What's today been like for them, for their families?
Today has been extremely disheartening as we think about what we need to always be prepared for. With that being said, our staff were ready, and I'm extremely proud of our response. With that, we are also going to have to make sure that we stay in tune to what is the care that's needed after the violence that has been seen, not only for the children we treated, but I would encourage us to think about that for all of the children and families in the community. We, of course, are going to work through that with the specific ones we've treated, and we have had our Office of Wellbeing help our teams through the situations that they've encountered.
11 children. Can you give us an age range for those children?
I can. Our ages were between 6 and 15.
Were there children, because I know you guys put out a notice earlier today saying if any parents were not sure where their children
Sure.
would contact you, were there families that were separated?
We did have families that contacted us, and we went through our reunification plan, which was extremely successful for us today, and all of them have been reunited.
So you did have families you reunited?
We did have families we reunited.
Can you walk us through kind of just the challenges that a mass event like this would put on the resources of the hospital?
Sure. The challenges of a situation like this, of course, you can imagine, but while we're also treating kiddos that weren't at the parade today for other situations, illness, surgery, things like that, some of that needs to be reprioritized, which we did well according to our mass casualty and incident command situation and plan. We had to pause some of the surgeries that we would have done normally if this wouldn't have occurred, and we had to mobilize resources to take care of the families and the patients that presented to our emergency department.
You said 9 of the 12 had gunshot wounds. Can you describe the injuries of the other victims?
They were incidental injuries is all I can say.
And the ages 6 through 15, those were the total patients or the ones that were shot?
The ages of the pediatric patients we treated were 6 to 15.
How were the children that you saw? What was their, I guess, disposition like after going through something?
Fear. The one word I would just use to describe what we saw and how they felt when they came to us was fear.
Of the children who were shot, how many of them suffered serious and critical injuries?
All of them will recover, and I wouldn't say that any of them are critical at this point.
Had they been at any point when they arrived at the hospital in a state like that?
We quickly stabilized them, so I would say no, not in that necessary capacity.
What's it been like for your staff today, having to deal with this? Kids going to parade, seeing their favorite player, their favorite team, and having to deal with gunfire and violence.
I think that it's something that unfortunately we all have to prepare for. While I said this earlier, the staff did an amazing job, but we will have to do some wellness initiatives and recovery with our staff. This is nothing that you ever want to have happen, and you especially don't want it to happen in a situation where it is a mass casualty type of situation. You don't know how many you're going to get, what the response is going to be from trying to reunite people who might have gotten separated. And so while our staff all went into action, they have a lot of questions and need some help too. I do appreciate the outpouring of support that we've had from all of you and from the community to ask about our staff and to check in on what you can do to help us. That will be important. And I think it's important that we remember all healthcare staff in the community right now, as well as law enforcement and everybody else that responded to an extremely unfortunate circumstance today. And while they all may be trained to do it, it doesn't make it easier for them in the moment.
How long do you anticipate the children will be here? When do you think that all of the children will be up?
I don't know that yet.
Are Chiefs players consoling some of these children? We know that they were consoling some children today with these kids.
I can't specifically speak to that and which ones that they talk to or not. Of course, our goal is to bring them in, stabilize them, make sure they're getting the care they need, and I'm sure we'll hear stories after that.
All right, you guys.
Thank you guys
so
for your
much.
time.
I